All right, so let's get started. Hi, everyone. Thanks so much for joining us for today's seminar. We're happy to have you. We are also delighted to have Professor Retzef Levy as our distinguished speaker today. Retzef is a Spencer Standish Professor of Operations Management at MIT Sloan School of Management. He's also affiliated with the MIT Operations Research Center and serves as the faculty co-director and the MIT Leaders for Global Operations. Before joining MIT, Retzef was a Goldstein postdoctoral fellow at IBM, and he received his PhD in operations research from Cornell University. His research is focused on the design of analytical data-driven decision support models and tools, addressing complex business and system design decisions under uncertainty in various application areas, including health and healthcare management, supply chain, procurement and inventory management, revenue management, pricing optimization, and logistics. For his valuable contributions in these areas, he received several awards, including an NSF Early Career Award, Informs Optimization Prize for Young Researchers, Daniel Wagner Prize, and Harold Kahn Award. Additionally, he has received several prestigious teaching awards. Now, in today's talk, he's going to tell us about food and agriculture supply chain analytics and sensing, managing risks on human health. So Retzef, thank you again for joining us, and the floor is yours.
Thank you for the introduction, and thank you for the invitation. Let me just make sure that I share the right thing. Do you see my screen now? Well.
Yeah, great.
Okay.
So
yeah. So thanks everybody for the attention and for taking the time. I'm going to talk through some work we've been doing in the broad space of food supply chain and the risks that agriculture and food supply chains pose to human health. It might not be in the spirit of most of the talks that you heard in this seminar, but there will be some connections to what I would call supply chain design and market design. So hopefully people will find it interesting. I know that I'm planning to leave some time at the end for discussion, but please make it interactive. So if you have a question during the lecture, just don't hesitate, raise your hand, and the folks here will help me manage that and call you up and hear your question. So let me start by providing some context to the talk, I think that we all will agree that food is an essential need of society and humans. But food supply chains and agriculture supply chains also pose some pretty significant risks to human health. And I would like to highlight at least 4 primary risks to get going, just to provide a context. I'm not going to talk about all of them, but I just thought that it's good to start with just a high-level overview here. So the first risk is not getting access to food. Something that is called food security, and unfortunately around the world we currently have 700 million people living in hunger, and if your perception is that this is only problem of developing countries, the unfortunate reality is that especially when you define this as access to healthy food, even in the US there are tens of millions of people that live in what is called food deserts, that and these are poor neighborhoods that don't have physical access to fresh vegetables and fruits and other healthy food. So this is a global problem and by no means restricted to developing countries. And this lack of access, that by the way is expected to become worse and worse over time because of the growth of the world population and the even bigger growth or increase in the consumption of food, but that stands this food security issue stand in marked contrast to the fact that food supply chains and markets and agriculture markets are characterized by a lot of waste throughout the different stages of the supply chain, from the farm level throughout the consumer level, and some would say that we only use 30% of what is being produced. So there is a great deal of waste that stand in marked contrast to the lack of access, lack of appropriate access. Food safety and food adulteration, where food is contaminated either for unintentional reasons or intentional reasons, is a major, again, another major threat to human health, with more than 600 million illnesses because of contaminated food and water, and more than 400,000 deaths a year. And many of those sick and death cases are among kids. So that's another serious health issue. Environmental impact is another area of impact that has impact on human health. And here it's important to emphasize the two-sided impact. On one hand, agriculture supply chains are responsible for more than a quarter of the worldwide greenhouse emission. And at the same time, the environment has major impact on agriculture supply chains and agriculture in general, and the productivity of agriculture supply chains and so forth. So there is a complex two-sided relationship here. And finally, what I would like to emphasize or highlight, which is something very timely these days, is the fact that the food supply chains and agriculture supply chains are the source of many illnesses and pandemics of what is called zoonotic diseases. These are viruses or bacteria that jump from animals to human. And the most recent example is COVID-19, that has affected dramatically everybody's life over the last year. But that's by no means the first case of a pandemic of a zoonotic disease. In fact, SARS, avian, and swine flu are just a few other examples that maybe were not as dramatic as COVID-19, but still pretty serious. And today I'm not going to talk about all the topics. I'm going to talk about two particular issues here, one related to food safety and the other one related to zoonotic diseases. And the common theme throughout the talk will be how to leverage supply chain analytics and multidisciplinary field research to inform global policy and local policy in the US and China. And today I'm going to focus mostly on work we've done in China. But many of you know, I don't know if many of you know, but China is one of the biggest suppliers as well as the biggest consumer of food in the world. So anything I'm going to say on China has immediate implications on any other country almost in the world. But we do have some work we've been doing that was more focused on the US, which I will not have time today to talk about in great detail. So just a little bit more of preliminary background, and so let's just talk a little bit about the food adulteration, and it's definitely a global problem, and as public we usually are exposed to this problem through public media publications of scandals around food safety or food adulteration. On the right hand side, you see some reporting on which were motivated by series of outbreaks of foodborne illnesses and other issues related to food safety in Chipotle, one of the most popular fast food chains in the US. In fact, very recently, the government imposed on Chipotle maybe the largest fine ever imposed on a food company, north of $125 million fine because of all of these incidents. And on the left-hand side, you see a publication on the melamine case that happened in China in 2008, and perhaps was maybe the most dramatic food incident that is known in China that sort of tipped the point, was a tipping point, both with respect to the public perspective as well as the government approach to food safety. But the story in a nutshell is that brokers and farmers in the dairy supply chain added to the milk a poison called melamine with an attempt to increase the perceived protein level in the milk, given the tests and the pricing scheme that was existed at that point. And that contaminated milk ended up in baby's formula and injured and caused the death of thousands of babies and children in China. That's a very dramatic impact. But that said, I would like to highlight another perspective that maybe is less known for the public, but it's very important when you think about it from a regulatory perspective, which is the scale. So just in the US, if I just want to give you sort of a scale, so the US FDA, the Federal Drug Administration, which is one of the two organizations that is responsible to regulate food supply chains, they have to basically manage over 40 million unique food line shipments of imported food that comes to the borders of the US, for each one of them, they have to make a decision whether it's safe to bring it into the US, and with the ability to sample about 1% of these 40 million shipments, which it tells you that unless you have a very good way to prioritize risk, it's going to be a mounting task to do this effectively. And in China, it's a gigantic country. Just the reported incidents are, in north of hundreds of thousands. Right? So there are different scenarios about to think about different scenarios when you think about food safety and food adaptation. There are different scenarios and there are different ways to classify those scenarios. But what I would like to propose next is a way to classify them based on the intention perspective, from the intention perspective. Whereas if we think about the Chipotle restaurant chain scenario, this is something we can classify perhaps as an unintentional adaptation that is caused by perhaps by negligence or not having appropriate practices, but maybe it doesn't have an intentional aspect into it. And maybe the other extreme is an intentional attack on the food system from a terror motive, contaminating water or food, with that in mind. And then in the middle is something that is often called economically motivated adaptation, in which the intention aspect exists. So stakeholders within the supply chain intentionally contaminate the food or adulterate the food, but the motive is not terror, but perhaps the expectation to gain financial benefits or economic benefits. And this, to a large degree, is going to be the focus of our work. Although the boundaries are not, black and white between these three scenarios, it's more of a continuous spectrum. It's interesting to point out that when you think about economically motivated adaptation, if you really want to understand that, then many aspects need to be considered, like the supply chain structure, the commercial dynamics, the testing capabilities, and the regulatory environment, the environmental factors. So it's actually a pretty complex set of issues that need to be brought together in order to fully understand and then, of course, mitigate such scenarios. So we have a big team at MIT that is working on this, and today I'm going to focus particularly on a project that we have in China on the ground for almost 5 years now. It started under this is funded by the Walmart Foundation as part of their Food Safety Collaboration Center. Back in October 2016, Walmart decided that their next environmental initiative is going to be focused on food safety and food safety in China, and they put together this center in Beijing, and we were one of the two first grantees of this center. So the work that I'm going to talk about is being funded by them, and it's a pretty exciting work. And one of the exciting aspects, exciting to me at least, one of the exciting aspects is the fact that it's really multidisciplinary. At MIT, we have engaged multiple faculty from the three schools of the university: the School of Management, the School of Engineering, and the School of Sciences, spanning expertise from supply chain management, advanced analytics, regulatory science, and then also expertise like food science, biomanufacturing, and others. So that's within MIT, but also outside MIT, we actually actively collaborate with the 5 different Chinese organizations on the ground here in China. And these organizations never work with each other. They include universities, 2 universities, 2 research institutes, and 1 private company. I'm not going to go over all the names. You can see it. It's probably you can read it just like I can read it. But it's pretty exciting in that respect. And what I want to emphasize again, that until COVID hit, this was very much a project on the ground. So on the right-hand side here, you see a research seminar in China, more than 40 people in the room. And speaking about markets, these are us going, touring markets in China, agriculture and food markets in China. So it's really touching markets. So at least in that perspective, it connects to the theme of this seminar, hopefully. Okay, so what is my agenda from now on? I'm going to start by talking about data, because one of the challenges with data in this space is that data often is not available, but even if it's available, it's not usable. So sometimes you actually need to invest a lot of sophistication, including artificial intelligence and machine learning, to actually create usable data. And then hopefully I'm going to give you a few examples what you can do once you actually enable usable data, and how do you actually translate that more than just research, but also to concrete decision support tools that can help to inform policy makers as well as industry stakeholders. So let me start with data, as I promised. So surprisingly, in China, the equivalent of the US FDA, the China FDA until recently, but as of recently, they changed their name to another organization as part of a organizational change that they made in China, is mandated to post all the tests conducted on food products in China in the public domain. But what is the challenge? The challenge is that the regulatory environment in China is highly fragmented, and you end up having a central state level database that is relatively more structured, but then each province and each prefecture in China, so China is broken into provinces, 33 provinces, and then each province is broken into major prefecture cities. So each one of them has its own website, and they actually post their own test results in a completely unstructured manner, inconsistent manner, over hundreds of websites. So currently this data resides in a completely unstructured, non-uniform way over hundreds of websites. So it's not very useful, as you can imagine. And we, over the last several years, created an automated set of processes leveraging machine learning that has created the data and is actually scraping the data on a regular basis for most of these websites. And we currently have more than 5 million food test records, managing thousands of files and many different types of formats of data. And we do that with a team of one and a half people, using and leveraging extensively machine learning and text analytics. And let me just take a few minutes just to explain to you the challenge, right? So what you're going to see here on the left-hand side, this is the raw data, and on the right-hand side is how you actually take that data and unify it into some harmonized taxonomy. So what you see in the first example here, this is a description of a test that was conducted in a supermarket in a given city, and the algorithms that we built can identify the supply chain location, in this case supermarket, in the city in an automated way, right? Here's another example where small yellow croaker is a type of aquatic products, and our algorithms can actually, machine learning algorithms can identify automatically the product category and sort of filled it into the database automatically, right? And finally, the last record on the left-hand side here is a failed test and the other transfers that were detected in the test. And again, we are able to define, to identify that the test was failed and what were the other trends that were detected. So that allows us to actually create a very unique data set, a major data set that is being updated on a regular basis. In fact, we are planning to open it in the near future to other academics to do research on it. But let me just show you a few things that are enabled once you are able to create a data set like this. So I'm going to take as an example one of our focus area, which is freshwater grown aquatic products in China. The culture is that they like to buy fish and seafood live. And what you see here is a schematic, a maybe simplified version of the supply chain in China of freshwater grown aquatic products, starting on the left-hand side with millions of farms that, unlike the US, are not vertically integrated by and large, but rather are very small family-owned, household-based farms, millions of them, that then goes through a network of brokers, either directly to manufacturers or to these large distribution markets that are called wholesale markets. From there, they continue to secondary markets and wet markets and being sold to consumers, or go to retailers and restaurants and get to consumers. Now, and I'm going to talk about it more. The China FDA tests extensively at retailer stores. And what we wanted to ask ourselves is not where the problems are detected, but what is the likely source of the problem in the supply chain? So, for example, let's say that you have a test in a retailer store that detects a residue of illegal antibiotics. That's most likely coming from the farm practices. On the other hand, if you found a dye or a preservative, it could be coming from the manufacturer, and maybe if you found the heavy metal, it's coming from the environment. So because of our data set, we are able now at a large scale analyze every failed test and what was the resulting or likely source of the risk. And basically what turns out that most of the risk is coming from farming practices, about 40%, and manufacturing practices, 46%, and the rest is coming from the environment and the circulation parts. And that already immediately creates an interesting insight that basically the current testing is emphasizing the downstream sites like retailer stores, but not necessarily testing where the source of the problems are. Okay. So let's just go in that direction a little bit more. One of the other things that is very special about this supply chain is this existence of wholesale markets. This is actually something that typically does not exist in developing countries. These are, again, large markets that have, the very large of them are basically more, you can think about them as a consolidation point of the supply chain that for many product categories like vegetables, produce, and also aquatic products, they serve as the major distribution point. And in fact, there are about 5,000 wholesale markets in China that are consolidating about 80%, 70 to 80% of the supply of some of the most important product categories. From there, it's being distributed into the secondary markets and other markets, and other end users, retailer stores and restaurants. And as I alluded to it before, based on our data set, we can actually understand what is the current test resource allocation of the China FDA among all of these locations. So as I mentioned before, most of the tests are conducted in retailer stores, and just a little bit, the rest is being kind of split, but relatively little attention is being given to wholesale markets and wet markets. Now, if you actually look on how the supply is distributed here, and we know that based on some available data, but also some surveys that we did in markets in China, actually most of the supply that goes through the wholesale markets is going to 70% of it goes to wet markets, secondary markets, and just a small fraction of it goes to manufacturers and restaurants and retail stores. And moreover, when you actually look on the failure rates of tests conducted in all of these locations, it turns out that most of the higher failure rates are actually happening in wholesale markets and wet markets, which raises there's a question?
Yeah, that's a quick question from Sanchita. What is the basis of sampling? Is it random or there's some logic?
So that's a great question. Yeah. So actually, well, I'm not sure what random is, but at least the China FDA formal policy is that it's a random testing, right? Now, like anything in life, there is nothing else random, but in fact, one of the conclusions that we have is that it's actually not based on risk. It's based on it's really random. And there's a lot of evidence that that's close to random. And there are nuances to this that I don't want to discuss today, but some of it is actually also has to do with the logistics of testing that very much relies on third-party labs that get assignment from the government. And now, and that's actually ongoing research. We actually suspect that many of these labs are going to test more in places that are closer to them geographically, because they are being paid for the test and not for right. But some of it is being supervised partially by the government, and some of it is not. But it's actually pretty clear that uniform sampling is not the right approach here, other than for exploratory purposes. And in fact, you actually want to be much more risk-based. But one of the things that emerged from this picture is that you ask yourself, why not to allocate more resources to hostess markets, because the failure rate is higher. But of course, for our people, and definitely for this audience, the immediate claim say, hey, you cannot just immediately say that you want to shift resources from retailer stores to hostess markets, because there might be endogeneity impact here, that the level of testing could be affecting the level of adaptation, right? So we actually wanted to take a little bit more rigorous approach to actually look at this, and that's what I want to show you next. And we're taking a pretty simple approach here that basically say, hey, let's say that we have supply chain locations, like manufacturers, retailers, hostess markets, like what we saw in the previous picture. And what we want to do is to optimize the following thing, right? So we're going to decide how much to test in each location, where TS is going to be the minimum testing level that we need to do, and excess is our decision. We want to allocate some testing resources of overall testing, a number of tests, capital T, among all of these locations. Whereas V of S is the volume of food going through that location, and F of Fs is a function of the testing level that represent the adaptation rate as a function of the test of the amount of tests that you conduct, right? And basically that captures the endogeneity in a more precise way, a more direct way, in the sense that if I test more, I expect that this is going to be decreasing in the number of tests that allocated, right? So what we wanted to do next, and what you want to do is to minimize, right, the amount of adaptation times the volume, weighted in the volume, right? So by allocating more resources to different places, you reduce the amount of adaptation, and you want to kind of get the most overall the system. You want to minimize the adaptation, right? And again, you can think about other objectives, but it's just for the sake of discussion, right? So what we needed to do now is to really estimate the function. V of S is pretty easy to estimate from the data that I showed you before, but what about this function? We wanted to estimate it from data, and for that we went back to our data. So what you see here is each point here is the province, and for each province we locate it as test per capita of, in this example, of manufacturers, and the level of adaptation that we see, namely the failure rate of the test in that particular, for that particular set of manufacturers. And as you can see, as expected, there is a decreasing relationship, which is being explained pretty well by this function, by this functional form. We actually tried other functional forms. So what we did now, we estimated that for each one of the supply chain location, and then we actually went to back to the optimization problem that I showed you before, and we actually saw what is the optimal solution of that problem, right? And this is the current allocation of resources that they have in what I showed you before, right? This is the current state, and this is the total number of tests per capita that are being conducted. And we wanted to say, hey, let's just assume that they have the same capacity, and we want to optimize this with respect to total adaptation across the system, right? And as you see here, we need to indeed shift things from from supermarket and retailers to wholesale markets and wet markets, right? So it does look, at least, that the current equilibria, if I call it equilibrium, the current solution of the current approach of this China FDA does not seem to be optimal, even if you consider endogeneity impact, right? Now, again, I'm not suggesting here that it's a straightforward, oh, we know what the policy is. I'm just saying there is strategic misconception here of how they allocate resources. And I think there is a big opportunity to optimize that. And again, of course, the actual optimization might be more involved because you always have more considerations to take into place, but hopefully that gives you a stronger signal that something can be improved here. Okay, so this is a rather big insight here. Yeah, more questions.
Quick
yeah,
question.
sure.
Yes, so this is very interesting. I just wanted to ask, like, in terms of logistics, so you mentioned something about logistics of testing.
Yes.
Isn't it easier to test on the wholesale markets because there are like few of them, are more
so that's a great question. So there are a few of them. So from a strategic point of view, it's really a buy, right? Like in a gigantic place like China, 5,000 locations, you can actually test 80% of the supply. You should take it today, right?
Right.
The problem is there are other challenges. So one of the challenges in wholesale markets is the food there is moving very fast through the wholesale market. Sometimes it's there only a day or only several hours. So that's going to create some challenges. And the other thing is, remember, wholesale markets are not within the city. And if indeed you don't have the logistics to be near the wholesale market, so when you ask logistically, it depends on what system you have in place. So it's not clear that for the system that China currently has in place, that's easier, right?
I see.
That said, it does give you a sense that maybe you want to build a system for which it's going to be easier. So you're absolutely right that we actually believe, and we definitely, that's the insight that we also communicated to government officials in China, that they have a big opportunity here to manage a lot of the supply chain flow in a relatively small number of locations. They should think very hard about how to do that.
Right.
Okay, so
great.
good insight. Okay, so I want to switch gears and actually want to say that the interest of wholesale markets and wet markets, it's not only in the context of food safety, but in fact, when you actually think about all the outbreaks that happened of zoonotic diseases that originated from China, COVID-19 is the last one, they are all associated in one way or another, in a more or less direct way, with wholesales and wet markets. So the question that we wanted to ask ourselves was twofold. One of them is, it seems important to understand risk at the market level. And then also we wanted to see, is there any correlation between food safety risk or food adulteration risks and the outbreak of zoonotic diseases? Okay, and basically that's what we needed to do. So the first step was we wanted to identify all the animal products tested in our database, the database I mentioned before. We wanted to actually associate it with each record with the specific market. And that's a challenge. In a second, I'm going to go back to it. Why is it a challenge? Then once we do that, you want to create a risk score for each market that is based on the failure rate of the tests associated with that market. And then you want to lift it to a risk score to the province. And we took basically the amount of flow of supply that goes through high risk markets within that province. And then finally, we wanted to associate that with zoonotic diseases, and the data that we have is from an international database about zoonotic flu isolates that were detected in each one of the provinces in humans. Okay, so that's kind of the overall roadmap. And I want to start by the first phase and sort of explain to you why, in spite of the fact that we had a relatively structured data set, we need to do far more work to actually associate each record with a single market. So one of the challenges that we had is that we actually don't have a comprehensive list of all the markets in China. It's actually not easy to get. And moreover, these markets, and here's one example, these markets in the data set are being mentioned in so many different ways. So this is one market. This is the Wuhan market, that seafood market that was associated with the COVID outbreak in Wuhan. Look on how many names, different names, it's being called in the data set, right? And to make things worse, if you actually want to apply some clustering algorithm based on text analytics to Chinese, actually it doesn't work out because of the differences between the Chinese and English. Okay, so what we had to develop is a specialized clustering algorithm that really leverage in a very fundamental way an understanding of how the names of markets in China are set up. So if you actually think about it, you have a geographic keyword or geographic part that may or may not exist. Then you have the main name, and then you have part that could classify the specialization of the market, and using that structure plus some more sophisticated machine learning, we were able to actually come up with an algorithm that was able to assign each record in the database that we had to the market associated with it with an accuracy. This is actually a conservative estimate of the accuracy. The actual accuracy is probably higher, but 93%. So, and this is kind of evaluating it on 3 provinces for which we actually had all the names of all the markets. Feeling quite confident about that, we actually created a risk score for each market or for most of the markets in China. And what you see here is a visualization tool that we created that allows you to actually see for each market in China, what is the risk score, okay? And interestingly enough, when we leveraged the market level risk score to a province level risk score and correlated it with the zoonotic flu cases, even though we control for a lot of other variables, it looks like actually there is a correlation, there is a significant correlation, which leads you to sort of think about the hypothesis that there are probably common system level environmental factors that drive these 2 risks, right? That sanitation, for example, could affect food safety risk and zoonotic disease risk, right? And maybe other things, right? So it actually makes understanding the inner and out of the management of those markets very important, and also suggests that the regulatory effort around this, unlike what is happening today, should be unified, right? Currently, there are 2 different organizations that are managing zoonotic disease risk and food safety risk. Yes, a question?
Yeah, so I'm wondering if there are also considerations in terms of the cost of fixing the problems once maybe after or even before the tests are conducted. So, supermarkets are very close to the consumers, and you probably, if there's a problem, then it's probably very costly, and you have a very short amount of time to react compared to upper level when you're further away from the consumers.
Yeah, well, it goes both directions. So let me just say, so absolutely right that testing close to the source makes it easier to fix the problem. In fact, testing in the retail store, usually you don't know even what the source of the problem is because you don't even know. The supply chain is quite opaque. But that said, it's much easier to find a retailer chain than to find a vendor in the horses market. In fact, every time a horses market, a retail store has a problem with one of its products, they pay like $50,000. And in fact, there are actually professional people that their job, what they do in life is to go to retail stores, buy a lot of stuff and test it just to show that they were harmed, and then they sue the retail store. So I think it depends on what perspective, what hat are you putting on, right? But you're absolutely right. That's from a regulatory perspective. If you want to fix the problems, testing at the source is much easier. And one of the other advantages of horses markets, that there are maybe a place where you can actually also create transparency in the supply chain. But what I want to go back to this insight that basically says, there is some common underlying, there's likely to be common underlying risk factors that drive these 2 types of risks that currently are being managed differently or by different organizations. And just to make the point, we actually have studied horses markets in China in a very, very detailed way, and we're still studying. And that included a field survey, maybe the largest field survey that we conducted together with our partners in China, that included all the aquatic product horses markets in China, in 3 provinces in China. So it's hundreds of markets that were surveyed by many people. And we're also working currently with the horses market in China to develop a new management approach to how to manage a horses market that will basically include rapid testing, partially on technologies that some of our faculty in our group are developing, but also digital platforms and how you actually use that to create better transparency of the transactions in the market. Currently, the transactions in the market are completely opaque. They are not being documented. They're often documented on paper. We want to actually put all of this on digital platforms and use that as a building stone to a building block to cornerstone to develop a new approach of how to manage wholesale markets in China. And that's a pilot that we started currently in the field with the wholesale market in China. COVID a little bit disrupted this, but we hope to get back to this soon. Another thing that we did related to wholesale markets is, again, using analytics to actually guide testing, not at the level beyond uniform sampling. And this particular analysis was within aquatic products, really focus on the types of fish or the type of products that seem to have the highest risk. And we ran a pilot in the field where we sampled the wholesale markets in China with a testing lab in collaboration with the testing lab in China. And the result is basically that we show that you can find up to ×6 factor more problems and more risk, and eliminate more risk on the supply chain if you actually use analytics to guide the testing versus uniform testing. And again, this is a paper we recently submitted to Food Control, which is one of the two major papers in the space of food safety. But let me before I open it to more questions, talk about something else that we currently do about wholesale markets. So going back to the issue of zoonotic diseases, there is as I said, there is a kind of a consistent observation over past outbreaks that many, if not all of them, are associated with wholesale or wet markets. And the other thing that is striking, that when you actually look on test results for zoonotic diseases in China, you often see that the rate of detection at the farm level is very low. So the infection rates at the farm levels do seem very low. Nevertheless, somehow the outbreaks happen in the wholesale markets, although the farms are feeding the wholesale market, right, and the wet markets. And what we wanted to understand is, like, why is that the case? Is there a model? Is there a model that can explain why, in spite of the fact that you observe relatively low rates of infection or detection at the farm level, you see, not every day, but every several years, you see an outbreak at the market level, right? So these are the research questions that we had. And again, this is the picture to remember. There are many farms feeding into the market, and then from there it's being distributed. So there is a consolidation point here. And a lot of flow goes through these markets, but somehow at some point we have an outbreak, right? And we think that there is a relatively crisp model that explains this phenomena, right? And it's basically thinking about some classical epidemiological model, but with some modifications, right? So without getting into the details, most of the epidemiological models, and here we're talking about a variant of the SIR models, are talking about the fact that there is infection between individuals that are infected that transmitted to individuals that are not infected, right? But are still susceptible. And that's kind of the beta parameter that we see here. The two things that we add to the model is that there is also an infection or contamination that goes from infected individuals to the environment, and then from the environment to uninfected individuals. And moreover, that infection of the environment has some level of persistence. So think about it this way: you have a flow through the market, a small number of the individuals that go are initially, let's say, infected. They leave infection at the market level, at the environmental level. Then they leave, but the infection stays behind. More individuals comes. Now they are being infected and leave more infection in the market, and then so forth and so forth, right? And if you believe that that's what is happening, and we have a lot of reasons to believe that this is happening, then you actually see mathematically that in spite of the fact that you can have a constant flow of relatively low rates of incoming infections, when you actually look on the outgoing flow, it could be much more magnified, right? To the extent that when you actually look on reasonable parameters, right, you actually can see that even, and this is the blue, even when you have an incoming flow of low rate infections, if you look on the infections on the outgoing, you will have different regimes, but from time to time, relatively infrequently, you're gonna have an outbreak. And the reason is that it's still a low probability event, that once you start to have enough, as you know, it grows exponentially and it starts to blow up. And the other thing that I just want to emphasize, that some of these parameters, for example, the persistence, highly depend on, for example, sanitation practices, right? Like if you sanitize every week versus if you sanitize every month or don't sanitize at all, right? Then that actually will affect how these parameters behave dynamically over time. Other things that can affect are the weather and so forth. So our initial results suggest that we actually can explain what we observe in terms of the frequency of outbreaks and the season of outbreaks. So that's pretty exciting, and this is something we are currently writing. This is a working paper, but again, another branch of our research on houses markets. I'm about to finish, but I want to highlight, before I leave some time for questions, I want to highlight that what I talked about is very much aligned with the recent priorities and policies by the Chinese government. And here you see two publications, recent publications by policy organizations within China. One emphasizing the importance of risk analysis and supply chain management based food safety regulatory systems. So using data to inform risk. And the other one specifically talk about the importance of smart digital management of houses markets. So to some extent, we expect that the work that is being conducted by our team will help inform these priorities and how to actually operationalize them and really be able to use data. And just to summarize, I think our community that can bring together both analytics, but also the understanding of supply chain management, as well as the market aspects of it, can have a major role in understanding the phenomena that we see here, but also informing the solutions. We saw a few examples of how risk-based regulatory resource allocation can play a major role in improving these policies. There are other technologies that we can and should leverage, like the IT digital platforms that I mentioned, and also testing more rapidly. So I think that once these are being implemented, there will be more opportunities even to design these markets, both physically and digitally and commercially. And then there seems to be strong evidence that food safety risks and zoonotic disease risks are pretty much related, and maybe we should think about them together. So with that, I think we have exactly 12 minutes for questions and discussion. So I look forward to your questions and the discussion.
All right, great. Thank you so much, Retsa, for this very insightful talk. I want to first ask audience if anyone has questions.
So maybe I would stop sharing if you don't mind, so I can see, and I can go back to sharing if someone has a question on a slide. So
great.
This way I can see everybody better. So
nice. If you have any question, feel free to raise your hand. In the meantime, I can also ask a question. So my question was about like this, the SIR model you were explaining toward the end, a very interesting new model. So you mentioned that with intervention, we can try to change that persistence factor by,
for example,
yes. Yeah. Right, great. And I was just wondering if the transmission factor is also something that can maybe be.
Yeah, you could. So for example, one of the things that is playing a role is there is an incubation time between an individual becomes infected, and in many cases there are practices that actually requires you to quarantine the chicken for X number of hours before you are able to bring them to the market. There are other things that you cannot actually keep live animal overnight, but not all the time these regulations are being preserved. So yes, I just gave the example of sanitation, but there are other interventions that can be captured through this model and how they affect the different parameters. So that's a great question. I just didn't have time. I didn't think that I have time to go all the details, but yes, absolutely.
All right, great. And one more question. You mentioned that the Chinese government is thinking about improving data collection for wholesales. Is there any effort for trying to unify all those data sets, because you showed us at the beginning that there are so many different formats.
Yeah, I mean, I think the Chinese government is posing more of a priority to manage the markets better and through digital platform. I think that one of the things that surprisingly in China is that policies are very centralized. Implementation and execution is completely distributed. And that's a challenge. Like, to me, it was a surprise when I learned to know, my prior in China was like, it's a very centralized place, right?
Exactly.
Like I think for most of us, it might be the case. But in fact, when in many aspects, it's a much more decentralized place than the US. The US, the FDA makes a policy and also is responsible for enforcing, and it's one organization. In China, it's actually many small organizations, local organizations, and there is the interaction with the local government, with the city government. So it's much harder to create efforts to unify data. And I think that there are some, but it's not obvious. It's actually far from being obvious.
Very interesting.
I see
Great.
some question there.
Question. Yeah.
Yes, we do have. So the data that we have is on different flu isolates. So actually, there are different levels of infectivity for the different isolates, and different, even within avian flu, there are different degrees of infectivity. And by the way, you can also capture that in the model and through the different parameters. So that absolutely not all of these isolates or types of zoonotic viruses are the same in terms of infectivity. And then, what changed your team doing research? What changed? Well, travel was prohibited, so that's like created barriers. Clearly, the expansion to zoonotic diseases was motivated by that. We started kind of even before, but this was, unfortunately, we got a reinforcement that it's important. Yeah, but logistically, it's much harder currently to do research in the field, right? Like as many of you probably know that they also, luckily, we have a lot of partners on the ground that can do things, but definitely the last year was not the same pace of progress, and we hope soon that the world will become more normal so we can go back to do research on the ground. So we used to be every 3 months in China, with like a group of 8 people, sometimes more, for a week or so, and that's definitely is missing currently. Okay.
All right, great. Thank you, Sanjita. Any other question from the audience? I have one last question, which is, I remember at the beginning of the talk, you mentioned that you also have similar initiatives and effort in the US. I was just wondering if you could share with us in like a couple minutes.
So we worked with the FDA on similar issues several years ago, and we currently talk to them again. I think that COVID-19 raised other issues related to food like disruptions of food supply chains, right? Like it's critical. So that's another big issue. We also have work in India on food and agriculture supply chains. I really believe that this is, if you actually think of where the world is going, and what are the major challenges that society is facing, almost all of them have some, if not very significant, connection to food and agriculture. So, and if you actually look on the area and the research in this area, there is actually relatively little modeling and little analytics and little use of data. So I think it's almost like an opportunity that is calling for people with our training. I would, part of my, one of my hopes giving talks on this is not just to tell people about the work we've been doing, but also to encourage and maybe inspire others to start working on those issues, because I think there are many more questions that our team can answer, and we need a much larger body of work and scholars working on that. And I think I really believe that this is an area where the informed community, broadly defined, can actually play a major role and impact in a very significant way policy and industry practices, because this industry currently is very immature in terms of these approaches. And finally, also the FDA in the US, they recently launched an initiative that is called strategy that's called Smart Area of Food Safety, which is exactly about using analytics and supply chain analysis to inform these decisions. So I want to encourage everybody, and I'm happy to talk with people that want to ask me questions or get guidance of where to start to consider that. And actually, we're studying also we have an initiative now around that in the school and also in the university, but we also start to now inject it into the curriculum, because we have a growing interest in food tech and agriculture among our students. And I think that that's also coming, because that's, an area around water, around food tech and agriculture tech. It's a very big precision agriculture range of issues that I think will be also substantial business opportunities. So.
Yeah, I completely agree. Hopefully this talk inspires some in the audience to work in this area. So that was great. Thank you so much, Recep.
My pleasure. Thank you.
And thank you everyone for attending. I think that concludes today's
enjoy the weekend. Enjoy the weekend,
same,
everybody. Thanks.
Same for you.
Bye.
All right. Bye. All right. Bye, ladies.
Bye, Vahide.
Thanks, Akshaya. Bye.
Thanks, Akshaya.